In my previous video, I spoke about pregnancy and characteristics of labor. So today, I will be talking about pathologies and impairments related with pregnancy which can be addressed with physical therapy. So I will talk about some of the pathologies and later we will move on to the exercises. So pathologies, the first one, let us talk about diastasis recti. Now, diastasis recti in itself is a vast topic, so I will try to make a separate video of the same. As of now, let us just know what diastasis recti is briefly. So, diastasis recti is the separation of the rectus abdominis muscle in the midline at the linea alba. The separation greater than 2 centimeters is considered to be significant. Now, what can be the reasons of diastasis recti? It can be because of hormonal changes during pregnancy, because of biomechanical changes, because of decreased abdominal tone during pregnancy. So the ladies who has good abdominal tone before planning pregnancy, they have very less risk of having diastasis recti. And yes, also during labor, due to excessive breath hold, also the woman is prone of getting diastasis recti. Moving on to next, postural back pain. So this is one of the commonest complaint of a pregnant lady, that she is having back pain. So why does this postural back pain occur? It happens again because of the laxity of the joint. Due to hormonal effects in the connective tissue during pregnancy, the joints become lax, due to which the back pain occurs. Also because of the change of the posture. Now during pregnancy, the line of gravity and the center of gravity, it changes. So that also leads to the back pain due to decreased abdominal tone, and yes, because of increased weight also there is back pain. Let us move on to next, that is the sacroiliac pain. Now the sacroiliac pain, this is a stabbing type of pain which is localized in the posterior pelvis. This pain, it radiates from the posterior thigh up to the knee. So there is also radiating pain sometimes in the groin region and in the medial thigh also. Now the sacroiliac pain, it aggravates during prolonged sitting, standing, climbing and descending stairs. Yes, now let us talk about varicose vein. Varicose vein or varicositis is also common during pregnancy because of venous stasis in the leg, increased body weight during pregnancy, and also venous distensibility. Next, we also have joint laxity, as already spoken about, that there is hormonal effect in the connective tissue during pregnancy, which causes the joints to become lax, due to which a pregnant lady is prone to injuries. Then comes your thoracic outlet syndrome and carpal tunnel syndrome. Now, these two, nerve compression syndrome, is also common in pregnancy because of the changed posture or the faulty postures, and also because of the hormonal effects. So there can be thoracic outlet syndrome and carpal tunnel syndrome. Excuse me. Apart from all these, there are also many impairments which a pregnant lady faces, like stress being on the top. Next, urinary or fecal incontinence, which means a pregnant lady is unable to hold her urine or feces. Then comes pedal edema or the swelling of the feet. Decreased cardiopulmonary functions, decreased tonicity of the abdominal muscles, obviously the laxity of the joint. Yeah, so, or more than these are the basic things which a pregnant lady faces. Now, before moving on to exercises, let us first understand what precautions has to be taken before advising exercises to a pregnant lady. First thing is, always try to keep the lady rehydrated, as dehydration is very common during pregnancy. Avoid excessive breath hold, as this may lead to unwanted downward pressure, which might push down the fetus. Next, do not allow the lady to be in a supine position for more than 5 minutes, as this will cause compression of the vena cava. Also, encourage complete bladder emptying before you begin with the exercise. Include warm up and cool down exercises, obviously. And yes, to prevent orthostatic hypotension, also known as postural hypertension, ask the lady to stand from a sitting position or from a lying position very slowly. Do assist the lady while doing so. And the most important one is exercises can be modified. Not can be only, but it has to be modified according to the need of the lady, as different ladies have different problems, different bodies. Okay, all the bodies are different, so exercises has to be modified according to the need of the lady. So modification of exercises is always welcomed. Now we will move on to the exercises. Before beginning with the exercises, I would like to say that I will be talking about the exercises for uncomplicated pregnancy and postpartum. So these are the exercises which can be done by a pregnant lady who doesn't have any complications and also postpartum. Pregnancies differ, types of labor differ, how labor had occurred it differs, types of birth it differs. So yes, accordingly exercises also differs. So these are the basic exercises for uncomplicated pregnancies. So moving on to exercises, I will be explaining the exercises. Kindly refer to the picture shown on the screen. For diastasis recti, the woman will lie in hook-lying position with her hand crossed over the midline at the level of diastasis for support. Have the woman exhale and lift only her head off the floor. At the same time, her hands should approximate the rectus muscle towards the midline. Then have the woman lower the head and then relax. This exercise can also be done with pelvic tilt. So this is known as head lift with pelvic tilt. The positioning will be the same as explained earlier, just the woman will perform posterior pelvic tilt before relaxation. Now the other exercises done to improve the impairments caused by pregnancy are pelvic tilt exercise. The woman has to be in a quadruped position. Instruct her to do the posterior pelvic tilt. Now have her isometrically tighten the lower abdominals and hold, then release in to perform an anterior tilt. Have the woman practice pelvic tilt in different positions later. Moving on to next, leg sliding. The lady will be in the hook-lying position with pelvis in posterior tilt position. Ask the woman to hold the pelvic tilt and slide one foot along the floor. Have her slowly slide the leg back to the starting position. Next, let us talk about trunk curls. Now, this is contraindicated and should not be done if the woman presents diastasis recti. Now, if a lady already has diastasis recti, do not indicate this exercise. And yes, while doing trunk curls, protect the linea alba with crossed hands even if the lady do not have diastasis recti. Then comes the pelvic clock exercise. Ask the patient to ask the lady to visualize a clock where 12 o'clock is her umbilicus and 6 o'clock her symphysis pubis. Ask her to move her pelvis to 12 to 6 o'clock, then putting weight on her left hip she moves to 3 o'clock. Similarly, 9 o'clock meaning putting weight on her right hip. Later, when she learns this pelvic clock exercise, the imagination of the clock will not be needed. Other exercises which can be done are standing push-ups, supine bridging, quadruped leg raising, and modified squatting. So this was all about the impairments related with pregnancy and how you can address that with physical therapy. I will be repeating it again that different bodies have different mechanisms and different problems. So before starting with the exercises by yourself, consult a physical therapist for the same. Thank you.